Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the importance of a laboratory test called GAD65, glutamic acid decarboxylate 65. And I run this test on all new patients to check to see if if the levels are elevated. Because when the levels of glutamic acid decarboxylase are elevated, it means that there is dysfunction in the metabolism of glutamate to GABA. Glutamate uses glutamic acid decarboxylase to produce GABA. And oftentimes in patients who have autoimmune encephalopathy or have autoimmune disease in the CMS, in the CNS, will oftentimes have elevated GAD65. So it's a good measure of basically brain swelling. And so when you do have elevated GAD65, it is something that you really need to pay attention to in your patients. And it's something that absolutely requires treatment. So if it's due to Lyme disease, if it's due to Babesia, if it's due to Bartonella, if it's due to strep, if it's due to one of the viruses like HHV6 or cytomegalovirus, or even HIV, these are all infections that can very much affect the brain and cause brain swelling. So it's important that you identify that a patient has an elevated GAD65, and you can do that on Labcorp, just by a Labcorp test. And let me get you that test. The test number for GAD65 is 143008. 143008. So if you suspect that you have brain swelling, one of the best things you can do is test for that. There are also tests through Vibrant, which I'm not a big fan of, but Vibrant Lab, which will test for autoimmune antibodies in the brain. And there's also autoimmune antibodies in Molecular Lab, and that is a very good lab. So if you suspect that there's a autoimmune encephalopathy, Molecular is a great lab to use as well. So this will also govern your treatment. A lot of times these patients need IVIG, intravenous immunoglobulins, and the problem with getting these things is that you have to get them from either an immunologist or a neurologist, because IVIG is very expensive. And for the most part, somebody like myself is not going to get insurance approval, and it's very expensive. It's, I think, like $8,000 a month. And you really need to have a neurologist or immunologist write the prescription and deal with insurance authorities about that. So GAD65 is a useful test through Labcorp to check to see if there's brain swelling, and if there is, then appropriate measures may be needed. You might need to do a brain MRI with contrast. You might need to do a SPECT scan. I'm not sure what's necessary because everybody is different, but it definitely is a red flag that there's a problem with neuroinflammation in the brain. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.